KFSR and CMAC present the Central Valley Ledger, a public affairs program featuring stories from all over the Central Valley with Sevag Tateosian, 90.7 KFSR.
I'm your host, Sevag Tateosian. Welcome to the Central Valley Ledger. We're recording in downtown Fresno in the beautiful CMAC studios. Our guest this week is from the Fresno County Department of Public Health, David Luchini. Welcome to the program.
Thank you very much for having me.
A lot of things happening in this community, health-oriented, but let's start by talking a little bit about yourself. Tell us your background.
So I grew up in Sacramento, went to college in the Bay Area, St. Mary's College, and the nursing school was actually in Oakland. Decided during my years in nursing school, I wasn't sure what I wanted to do, and it wasn't until my senior year that I had my public health nursing rotation. And when the teacher came in with jeans and Birkenstocks and said, we're going to go out in the community, we're going to meet people and help them through, be it a high-risk pregnancy or an infectious disease, I just fell in love with it. And so when I graduated, lo and behold, it was tough to get a nursing job in those days in the early 90s, but in 93 I was able to get a position at Fresno County Department of Public Health, and I've been there pretty much since. It was a brief time I went to Kaiser, but otherwise I've been at the Public Health Department.
The market right now is hot for nurses, wouldn't you say? I mean, are they in demand?
Much different than it was in the 90s. In the 90s, they were actually laying off nurses. So now, yeah, there is a shortage, and we have a lot of nurses. The average age is still, late 40s, early 50s. So we have a lot of nurses that probably the next 5 years are due to retire. So we need a lot more nurses in the community.
How did you know you wanted to be a nurse? I mean, what was it about the nursing field that said that's the direction you want to go? Or maybe there's another story that you can tell us.
It popped up late. In high school, I didn't know what I was going to do. My family owned an ambulance business, so I was exposed to the medical field. I became an EMT and worked on a paramedic unit. So I got a lot of background there. And then at that time, my aunt was a nurse administrator at Kaiser. And she said, you should look at nursing because it would be a good field. At that time, there were very few men. And she really thought I would be good in that field. And so I listened to her and got into nursing school, and I don't regret it. I've really enjoyed it. And like I said, especially the public health nursing side. I really enjoy being out in the community and understanding what are some of the barriers that are keeping people from being healthy in our community.
Public health nurse, you've said that a couple of times. Is that different than the typical nurse? I mean, because a lot of times we think of a nurse, we think of someone in the hospital, we think of someone going bedside, giving care at a hospital or a doctor's office.
So typically a public health nurse is someone who has a 4-year bachelor's degree, Bachelor's of Science, and there's a component in that 4-year degree where you take a class on public health nursing, where the focus is, once again, out in the field, understanding the different components that impacts a person's overall health. So sometimes when we're in the hospital or in a clinic or even sometimes in home health nursing, you tend to focus just on the medical condition. And in public health nursing, you're really looking at holistically at everything that could be an impact. So you may get a referral in the home just for a high-risk infant, and you may end your visit on a number of issues, be it social services type issues, behavioral health issues, a lack of food, a lot of things that contribute to some of the health risks for that family.
What makes a good nurse? I mean, in your opinion, for people who are watching this and saying, I might think of a career change, I might want to go into a different field. I mean, the numbers that you mentioned about the need for nurses in retirement, it seems like a good field. So what would you say the typical or a good nurse is?
When I see the Fresno State nursing students come through and they're doing their public health nursing rotation, I tell them the number one skill they need to build up when they're doing the rotation, because it'll help them wherever they are nursing, is listening.
Listen.
You have to listen, because if you're not listening, you're going to miss a lot of things that will help you put together the plan to help someone.
So you get your job, Fresno County Public Health. Did you know that all the things that entailed? I mean, I'm sure you get there and you're like, oh, wow, okay, this is my job.
I've been very fortunate. When I started out in public health nursing in the 90s, we had general public health nurses. So you got exposed to a lot of different things that our public health nurses don't really get now. So once I would get referrals on high-risk infants, high-risk pregnancies, infectious diseases. There was a senior companionship program, so I got to meet seniors. There was a childhood lead prevention program. So you got exposed to a lot of things instead of just focus on one program. So it was a great start to be a new nurse and to just be exposed to all these different public health issues. And most of the areas I focused were West Fresno and Southeast Fresno. And then I had some parts of Kerman, Tranquility, and San Joaquin. So I got a nice urban and rural mix.
So, wow, so you were able to go west to the east, north to the south of the county.
And it was great because I learned, I was great at Spanish then. You know, when you really need to learn, you're working with a monolingual family, it really helped. And I was raised Italian. I mean, that was my first language actually, so it made it a little bit easier. But it was just great to be able to use the Spanish I learned in middle school and high school to be able to use it in the field.
There are a lot of people who don't understand the structure or what a public health department is. We can do a whole show on breaking it down, but generally speaking, describe what a public health department is. I mean, what are the services you provide? What do you do?
So you're right. In the public health department, we have a wide variety of services, and we're probably one of the few health departments that has programs in it that typically are separate. So some health departments don't have an environmental health. It's sometimes a separate department in a county agency. In Fresno County, environmental health services are part of the Fresno County Department of Public Health. So they're doing restaurant inspections, public school inspections. They have programs that are dealing with hazardous waste materials, hazardous spills, emergency services. Got programs investigating tattoo parlors to make sure they're doing it, safely. So there's a lot of programs in environmental health. Then we also have the emergency medical systems is part of the Department of Public Health, which once again in other counties usually is separate. And that's been great to be connected with them because they're dealing with the paramedics in the field, making sure our paramedics are well trained, not making mistakes that could, hamper someone either surviving or having long-term injuries.
I mean, the way you're talking, it sounds like safety. I mean, everything you mentioned, safety of people, safety of people. So safety is important in this department.
Absolutely, safety, and we have California Children's Services, which is a program that's been around since the early 1930s, that deals with children who have, pretty significant medical issues that need assistance with medical services, medical equipment. Then like we talked about public health nursing, and there's a lot of programs under the public health nursing department. And then we have our community health division that deals a lot with the infectious disease programs. And then one of our newer programs is the Office of Policy Planning and Communication. Now they deal a lot with what we talk about public health version 3.0. So I'm going to go real quick on the history of public health.
Which you're doing a great job, by the way.
When you hear public health 1.0, traditionally public health started out on trying to prevent infectious diseases, problems with sewage, things like that, to prevent illness. Then public health 2.0 worked on chronic disease. How do we help people control their chronic disease? Okay? Now 3.0 is looking more upstream.
Ah, interesting.
How do we prevent the chronic disease? How do we help people live healthy lives? So it deals with economics, it deals with transportation, it deals with planning, healthy foods, deals with all the things. Our goal is how can we help people who live in Fresno County make the healthiest decision they can on a daily basis.
You also have a health officer who, does writing, and we've seen him in the media. What is the role of Dr. Bird, the health officer?
A lot of our work, we're a designee of the health officer. Our health officer really dictates a lot of the stuff we do. Dr. Ken Bird is an excellent health officer, has a lot of passion about the community, and like you said, he's an excellent writer. He has put together some op-eds in the Fresno Bee. He has a great To Your Health article that goes out to a lot of community partners. It's also on our website that covers a lot of the priorities he wants to work on in Fresno County. And then he's one of the rare, we looked at this, he's one of the rare health officers that has a Facebook.
Oh yeah, wow, there we go.
And man, did we create a Facebook monster. He's posted nonstop.
So our audience members that are listening to this broadcast or watching us need to go find Dr. Bird on Facebook.
That's right. To Your Health.
To Your Health. And what should, just information about their health on there?
He covers everything. Like I said, he probably averages two posts a day, and he covers what may be happening nationally or in California, and then locally.
It sounds like there's a lot of work being done to get information out there. How important is the dissemination of information?
I think in the old days, it used to be if you didn't hear anything from a health department, that was good news. There's no crisis and no one is getting sick. That was the old way of looking at things. The new way, and I didn't even mention, we have a public health communication team that's really helped us be innovative on getting messages out. But the one thing we have done in the last 10 years is really not be afraid of being out in media, doing shows, writing op-eds. We feel it's important that the citizens of Fresno County know about their public health department, understand the role of the public health department, and be comfortable with the services that are being provided by the public health department.
It has been very hot in Fresno. We're in a hot time, 100 degrees, 106 degrees, 110 degrees coming up, and it's no surprise. We're in Fresno, right? So we expect it in
Normal
the summer.
July.
What advice would you give people so that they can stay healthy during the summer, so that they're not having heat stroke or anything like that?
Well, you got different people. There's those who have to work outside. So you're hoping when they're working with their employer that they've made ways to make sure that their staff are hydrated, drinking clear fluids, not drinking a lot of caffeinated drinks, alcohol, so that they're hydrated, and make sure that they have enough shade, take breaks, because you can really fall fast. If you're not hydrated, you're working hard, you're in that direct sunlight, you really got to monitor people closely because they can deteriorate very fast.
So let's talk about something that has been all over the media. Everybody seems to be talking about it, this Zika virus. So what is this Zika virus?
So Zika's been around for decades, but it popped up in early 2015 when in Brazil, they noticed a lot of children being born with smaller than normal heads. You'll hear the term microcephalic or microcephaly. And that's what that means, just a smaller than normal head size of the infant. And they kept seeing these cases. And when they started testing, they realized they were positive for Zika. And since then, the Zika virus has expanded to several countries. In the old days, typically we saw it in African countries and in Southeast Asian countries. But now it's throughout South America, Central America, the Caribbean, and the southern states in Mexico are showing local transmission. So this is another mosquito-borne illness. Now you say, well, okay, what do we need to be concerned? We're not South America, Central America. Do we even have the mosquito that can transmit that, right? Because we have a mosquito that can transmit West Nile virus, which we've been dealing with since 2003. So, lo and behold, yes, we do have the mosquito species called Aedes aegypti that can transmit the Zika virus. So that is a concern because we do have a lot of people who travel to South America, Central America, and the southern states of Mexico that if they come back infected and get bitten by an Aedes aegypti, they technically could transmit it.
So is this just any mosquito? I mean, and the reason why I ask, I was over at a friend of mine's house the other day, and he mentioned that he's got mosquito bites on his legs, and he was worried about that. Mm-hmm. When we get mosquito bites, they're annoying, they hurt, they swell up, but should we be worried? I mean, are we at a point where I got a mosquito bite, I'm panicking to the doctor?
No, not yet, because we don't have any active mosquitoes with Zika.
So how does the mosquito get the Zika virus?
So the mosquito get the Zika if they bite someone who's been infected with Zika.
Mm-hmm.
So that's why we try to tell people, first of all, when you're going to a country that has local transmission, make sure you're avoiding getting mosquito bites. Use the mosquito repellent that's been EPA approved. Bring long shirts and long pants. I know sometimes it's probably too hot to wear it, but if it's cooler, you need to wear long sleeve shirts and long pants. There's also some clothes that's permethrin, I'm probably mispronouncing the name, but that kind of help repel mosquitoes. You want to stay in places when you're traveling that have air conditioning, have good screens that are keeping mosquitoes from coming in. So those are all key things. Then when you return, we ask you to make sure you don't get mosquito bites for at least 3 weeks. So you need to continue using mosquito repellent and doing the same thing so you don't get mosquito bites.
And your fear there is that a mosquito locally here will bite you and then go bite another person.
Could bite someone else. Yeah.
As far as mosquitoes go, what should we be looking for around our house to make sure that they don't exist? Because I'll tell you, when I sit out in the evenings by my house, sometimes I get bit by mosquitoes. And by the way, there was a mosquito that I saw on me one time that I've never seen before. It had white stripes.
Well, it sounds like an 80s.
It was black. It had white stripes, and it scared me when
And it was
I saw
small,
it.
right?
And it was small. But I saw the stripes on it, and I panicked. But then I realized, you know what? We may not have the Zika virus.
That's right. We don't have any. We have not seen any Zika in the mosquito, but still, we still want to do a good job that we're not breeding mosquitoes. You know, we have great mosquito abatement programs that we work very closely with, but they can only do so much. They depend on us to first do our best to make sure we're not having standing water on our yards or even inside the house that could breed mosquitoes. So you need to make sure you're looking around the front yard, the backyard, in your house to make sure you don't have water that's just sitting around.
And by standing water, dog bowl
Yeah,
size
so
water?
dog bowls need to
or-
be changed often. You don't want to keep a dog bowl sitting there for a week without changing it. Mm-hmm. You know what I mean?
Yeah.
So because this mosquito just needs a little bit of water, maybe a teaspoon to breed. So, and they're sneaky. The difference between this mosquito and the West Nile virus mosquito, which is called the Culex, I can't remember the second word, but it's Culex. You know, they're much bigger. You tend to see them outside more. This Aedes aegypti loves to go inside the house. So mosquito abatement will tell you they have a much more difficult time treating, the mosquito population because of this type of mosquito likes to go inside.
There are movies out there where a virus takes out a whole community or a virus travels and takes out a whole nation. Should we be fearful that that might happen? I mean, could that happen?
We don't have a Walking Dead scenario at this time, in all seriousness. I mean, it's weird. 80% of people don't get sick from the Zika, right? So, but what we see concern here are once again, pregnant women who, if they get positive for Zika, then it can transmit to the infant, and they're the ones who have the problem with the microcephaly. We've seen miscarriages, stillborns, brain deformities from Zika. And this is still early. Like this is July. What is it? 26th.
We're in late July.
Late July. With Zika, they learn more and more. And I'll give you an example that we learned this past week on Zika. But as we learn more about the virus, they're looking at about maybe close to 10% of pregnancies of a woman who's pregnant with Zika can cause problems to an infant. So that's a fairly high number, once again, of a positive Zika pregnancy. So we'd really need to work hard, especially if you're planning to be pregnant or pregnant, to try to avoid these areas where there's local Zika transmission.
How do you test for Zika? I mean, so let's say that I go to one of these countries and I come back home and I want to test to see if I have Zika. Is it a blood test or?
The biggest thing is make sure you're working with your provider to see if you're at the risk of having to get tested. Then it's a simple blood test or a urine test that they can do.
One of the things right now that's hot in the media is the Rio Games. A lot of athletes have stopped from going to the games because of the Zika virus. If fans or people want to go out there to watch the games, should they not go because of Zika? I mean, how scary is this virus?
We're a small world, and there's risks of a lot of different diseases that could be wherever you go, right? So once again, you just have to educate yourself. If you're bringing the right mosquito repellent, wearing the right clothing, monitoring things, they're doing their work in Brazil to make sure they're controlling the mosquito population. Then there's no concerns. It's just be aware of your environment.
You talked about mosquito to human transmission. Talk about human to human, or are there other ways that this virus can be spread?
So I'm glad you asked that question, because this has been very interesting on this Zika virus. So unlike West Nile virus, right, you need to be bitten by a mosquito, and that was the only way you can get West Nile virus. So with Zika, you can get Zika other than a mosquito bite. And that is if you have unprotected sex with someone who is positive for Zika. Originally, we thought it was just male to partner, right? Male to male or male to female. Well, in the last week, we now have just learned that it can be also female to female or female to male.
Interesting. So just be cautious is the advice you give.
So you've got to be cautious. So once again, if you're a male and you have a partner who's planning to be pregnant or is pregnant, then you need to make sure you're avoiding sex or wearing protection. That is critical.
And there was someone in the media locally that may have Zika. Without going into details about this person, have we seen someone with Zika in Fresno County? Has that case been reported?
We've had one Zika case so far, as of this date, late July.
Yeah, because anything could happen.
That's right. It was travel related, where they were in a country where there was local transmission. Thankfully, they live in a part of the county, in the southwest rural part of the county, that does not have the Aedes aegypti at this time. So we're fortunate. Our team at the health department educated the person to make sure she could avoid areas where we do have Aedes aegypti, stay where she was from, because we didn't have an issue with that mosquito population of Aedes aegypti. So knock on wood, we're past the incubation period, so everything worked out well.
Again, I'm going back to information because information is so important here. How does the health department hear of these things? I mean, when Zika virus came out, did you all hear it from the media, or were there calls or something? I mean, how do you get your?
I'm trying to use my memory to remember how. Usually we'll hear little things, but that hits the news. But it's when the World Health Organization and the Centers of Disease Control, when they start saying, "Hey, heads up, this is what's going on," that we really start paying closer attention.
This might be a tough question, but is there other communities that are really taking an aggressive stand to get information out like we are? Because in Fresno County, the media has been great in letting us know about Zika.
We're fortunate to have the media have been great with public health department. They have no problem calling us for questions. And like I said, we do our best to make sure we can handle every media request. We're not at 100%, but I think we're close to, at least 90%.
Who can they call, by the way? If we have media outlets watching the program now, who can they call if they want to learn more about Zika and some of the other stuff we're going to talk about?
If you're talking general public?
General public.
I would always start with our website, because you can get a lot of information from our website. Start there. Go on to Fresno. Oh my gosh, you think I would remember the darn website?
Google Fresno County
exactly.
Public Health Department.
Oh my gosh, fcdph.org. Sorry, folks. fcdph.org.
It's been a long day. It's been a long day, so.
It took me a while. Do we know what time we're taping this? Just kidding.
West Nile. Zika is completely different than West Nile. Should we be worried? Because here's why I asked. Because, a while back, everybody was worried West Nile, West Nile. There was some dead birds that people found, were fearful that got bit by West Nile. Is this virus still around?
It's still around. I mean, we don't have the big numbers, but it's going to stay with us. I think last year, I want to say we only had like a handful of cases of neuroinvasive. But when we're talking neuroinvasive, those are pretty severe symptoms. These are people who got hospitalized a lot of times because they had encephalitis or a meningitis that was caused from the West Nile virus. And we've had deaths in the past with West Nile virus. So even though the numbers aren't large, we still want to prevent people from getting sick. So once again, we've got to do our best to prevent breeding mosquitoes in our yard. If you have neighbors who may have unkept pools, call mosquito abatement. They can do stuff. So don't hesitate. They're there to help us control these mosquitoes.
Let's shift gears a little bit, and we're running out of time this week on the program, but we'll go into part 2 where we can continue to talk about some of this other stuff.
We're not on a special extended show?
No, a special extended show, but a part 1 of a 2-part series. What we're due today is, but one of the other health-related things is that the health department is looking into is like diabetes and stuff like that.
Yeah, so one of our areas, once we're talking about the Office of Policy Planning and Communication, they've really done a good job of focusing on chronic disease and preventing chronic disease. And it is amazing when you look at diabetes. Now, I mean, we shouldn't be too surprised because traditionally Fresno County has had a high rate of obesity, which can translate into a lot of type 2 diabetes. But some of the facts we just heard from a UCLA study were pretty shocking. 49%, almost 50% of our population is probably considered pre-diabetic.
Interesting.
That is a lot of people. I'm pre-diabetic. When I looked at the...
I'm pre-diabetic as well, so I'll join you on that one.
Let me go. See, this is why I had the notes here, folks. So, here's some of the high-risk factors, right, for being at risk of pre-diabetes. Being overweight, not being physically active, having a relative, close relative that has a history of type 2 diabetes, being over the age of 40, being a man, and if you're a woman, having a history of gestational diabetes. So that's a lot of stuff. Now, so what can you control? You can't do anything if you have a close relative, right? Can't do anything about age, but you can do something about being overweight, and you can do something about being physically active. And we're not talking about go
Miles
run
and miles
a
and
marathon,
miles and miles.
go ride the bike for 100 miles. 30 minutes of walking at least 4 to 5 times a week is plenty. And they've already shown, they've done studies on this. 30 minutes of walking 4 to 5 times a week. You can do that.
A lot of people, and actually we're going to continue the next part of the show, but part 2 will continue with some of these other questions. But for those who are in office jobs, getting up and stretching, is that important?
Absolutely. We try to remind people, even myself, we're sitting reading a ton of emails or sitting in meetings that are long. You really need to get up once an hour, stretch, take a couple of steps, walk around a little bit, because it is not healthy to sit in a chair hour after hour after hour. Some of the simple things we do at work, like I've done at work, is take the stairs. Don't take the elevator. Climb the stairs. That helps build up strength in your legs.
Let's talk about this in part 2 of this 2-part series, because right now we're out of time. So thank you so much for coming on the program this week and educating us on these things, but we'll continue with part 2 after this.
Thank you.
That's all for this edition of the Central Valley Ledger. I'm your host, Sevag Tateosian. Today's guest has been David Luchini, the Assistant Director of the Fresno County Department of Public Health. Did I get that right?
Very good. Very good.
Thank you. Thank you to the volunteer crew that made this production and every production possible. They're in the studio now making us look and sound good. We couldn't do this without you. Thank you also to our audience members listening to this broadcast on 90.7 FM KFSR Fresno, and to those watching on Comcast 93 and AT&T 99. We hope that you enjoyed the program this week. Tune in next week to part 2 of this 2-part series with David Luchini.
KFSR and CMAC present the Central Valley Ledger every Sunday morning at 11:30. For a complete program schedule, visit kfsr.org.